Over the years, Gregory Jacob Jr. told doctors in his regular medical exam that he noticed urinary function changes after intimacy with his wife.
We don't need to test you for prostate cancer or anything like that because, one, you don't have a history of prostate cancer, and two, you're young and you're healthy. The insurance wouldn't cover it because of my age and stuff like that.
Years later, at 41, Greg was diagnosed with advanced prostate cancer that had been growing since his early 30s. It was only then that he learned men in his family did have prostate cancer, but kept it silent.
And I was just blown away by the number of people that in my family that had it. And, you know, my whole life, I've been telling doctors I have no history of prostate, no history of cancer. I didn't know to advocate for myself.
Greg got busy on a book of his health journey so men wouldn't feel their masculinity diminished by the diagnosis and seek medical advice early on.
When we share our information, we give others the opportunity to make better choices in their life.
But after our story ran, this middle school teacher now in Texas got noticed.
Wow, it's been one great thing after another since our interview.
The Prostate Cancer Foundation interviewed him and invited him to the Cowboys-Eagles game in November to be with Hall of Famer Emmitt Smith, the NFL's all-time leading rusher. He advocates for prostate cancer after his father was diagnosed. Greg will be highlighted at the game. Next, the American Urological Association invited him to its conference in Washington, D.C.
They want to first allow me to speak on their largest platform, the Patient Perspective Program. And then you'll be a lobbyist for a day on Capitol Hill with the urologists talking about prostate cancer health.
This helps his mission of helping children and teens by helping save fathers and husbands.
I love helping people, as I'm a teacher right now, so I'm helping students. So now I want to hopefully, if God say the same, to transition to helping adults.
Get him,
That's
Greg.
really cool. Yeah, he's really doing what he said he wanted to do when he put his story out there in book form. So if a man is at high risk for prostate cancer, what should they do?
So this is serious, Cherise. Dr. Oliver Sauter, he's an internationally recognized prostate cancer physician and researcher with LCMC. He says for African-American men, it's particularly important to get that yearly PSA screening, it's just a blood test, starting early on, like 40. They're also at higher risk, and any man with a family history is also at higher risk.
Important information to have, and I'm glad he's getting the word out. Thanks, Meg.